Understanding the statistics, 10 explanations for the reason 80% of men will get prostate cancer. Shedding light on a startling statistic. Prostate cancer is one of the most prevalent forms of cancer among men, with statistics indicating that a staggering 80% of men will be diagnosed with prostate cancer at some point in their lives. This alarming statistic underscores the importance of understanding the factors contributing to prostate cancer risk and implementing strategies for prevention and early detection. In this comprehensive exploration, we'll delve into 10 explanations for the reason behind the high prevalence of prostate cancer among men, shedding light on the complex interplay of genetic, environmental, and lifestyle factors. 1. Age-related risk. Age is a significant risk factor for prostate cancer, with the incidence of the disease increasing dramatically with age. As men grow older, the risk of developing prostate cancer rises, with the majority of cases diagnosed in men over the age of 65. Age-related changes in prostate tissue and hormonal fluctuations contribute to the heightened risk among older men. Number 2. Genetic predisposition. Genetic factors play a crucial role in determining an individual's risk of developing prostate cancer. Men with a family history of the disease, particularly those with close relatives such as fathers or brothers who have been diagnosed, are at increased risk. Genetic mutations and inherited susceptibility genes can predispose individuals to prostate cancer, highlighting the importance of genetic counseling and screening for at-risk individuals. 3. Hormonal imbalances. Hormonal imbalances, particularly alterations in testosterone and other male sex hormones, can influence prostate cancer risk. Testosterone is essential for normal prostate function, but excessive levels or disruptions in hormone signaling pathways can promote the growth and proliferation of prostate cells, increasing the likelihood of cancer development. 4. Ethnicity and race. Ethnicity and race also play a role in prostate cancer risk, with certain populations experiencing higher rates of the disease. African American men have the highest incidence of prostate cancer worldwide, followed by Caribbean men of African descent. Asian men, particularly those of East Asian and South Asian descent, have a lower risk compared to Caucasians. 5. Lifestyle factors. Modifiable lifestyle factors such as diet, exercise, and smoking habits can impact prostate cancer risk. Diets high in red and processed meats, saturated fats, and dairy products have been associated with an increased risk of prostate cancer, while diets rich in fruits, vegetables, and whole grains may have protective effects. Regular physical activity and maintaining a healthy body weight can also reduce the risk of prostate cancer. 6. Environmental exposures. Exposure to environmental carcinogens and toxins may contribute to prostate cancer risk. Occupational exposures to chemicals such as cadmium, pesticides, and polycyclic aromatic hydrocarbons, PAHs, have been linked to an elevated risk of prostate cancer. Additionally, exposure to ionizing radiation, such as medical imaging procedures or occupational hazards, may increase the likelihood of cancer development. 7. Inflammation and chronic conditions. Chronic inflammation of the prostate, known as prostatitis, has been implicated as a risk factor for prostate cancer. Persistent inflammation can lead to cellular damage and DNA mutations, promoting the initiation and progression of cancerous growths. Other chronic conditions such as obesity, diabetes, and metabolic syndrome may also increase prostate cancer risk through inflammatory pathways and hormonal dysregulation. 8. Screening practices. Screening practices and detection methods can influence prostate cancer diagnosis rates, particularly with the widespread use of prostate-specific antigen, PSA testing. PSA testing can detect elevated levels of prostate-specific antigen in the blood, which may indicate the presence of prostate cancer or other prostate conditions. Increased screening efforts and improved diagnostic technologies have contributed to higher detection rates of prostate cancer among men. Number 9. Access to healthcare. Disparities in access to healthcare services and preventive screenings can impact prostate cancer diagnosis rates among different populations. Socioeconomic factors such as income, education, and health insurance coverage can influence individuals' ability to access timely medical care and cancer screenings, leading to disparities in prostate cancer outcomes. 10. Awareness and education. Public awareness and education initiatives play a vital role in addressing prostate cancer risk and promoting early detection and treatment. Increasing awareness of risk factors, symptoms, and screening guidelines can empower men to take proactive steps towards protecting their prostate health and seeking medical attention when needed. Conclusion: empowering men with knowledge and resources. The high prevalence of prostate cancer among men underscores the urgency of addressing risk factors, promoting preventive measures, and advancing research efforts towards better detection and treatment options. By understanding the multifaceted nature of prostate cancer risk and taking proactive steps towards prevention and early detection, men can safeguard their prostate health and reduce their risk of developing this devastating disease.